Hi, I'm Leiter. In Chicago Business Today, healthcare reform. If Congress passes a measure that would extend Medicaid coverage to millions of uninsured people, there are major concerns about what the legislation will do to already clogged emergency rooms in the Chicago area. There is a problem with too few doctors willing to treat poor patients, and now that problem could get even worse. According to a study by PricewaterhouseCoopers, a third of Medicaid patients had to wait more than 30 days for a doctor's appointment, compared with 22% for those with private insurance. Almost half of Medicaid patients had been to an emergency room in the last year in the survey, even though only about a quarter of those visits were actually considered an emergency. Crain's Colias and I this summer talked with Rush University Medical Center Chief Executive Larry Goodman, who talked about the increasing need for preventative care with the poor and uninsured.
Additional ones are absolutely warranted, and particularly for those people with limited access to care, this is a huge problem and something that can be remedied because there are absolutely evidence-based ways to reduce some of these serious infections to start with.
In this week's issue of Crain's, Colias profiles a rare breed, a Chicago doctor whose patient load is primarily on public aid or uninsured. Dan Ivankovich is an orthopedic surgeon in private practice. He could be clearing $500,000 a year performing hip replacements and fixing spines. Instead, he earns less than half that by taking on cases at the city's poorest hospitals. He performs more than 800 surgeries a year, about double the norm.
It's not like I've been forced to take a vow of poverty doing this. It's substantial. I mean, if I worked in suburbia and just focused on doing one thing, it would be a significant amount of money more. But I think I wouldn't be happy.
To make up for his measly Medicaid checks, Ivankovich is on staff at a dozen of Chicago's hospitals that treat mostly needy patients. These hospitals rely on doctors like him to be versatile. One day he may fix a spine, the next he may repair a broken arm.
It is challenging. I think that, our commitment was to just take everyone. We've never turned a patient away. I've never said, okay, we're capped out, we've done 50 this week, go away. My career and what I've committed myself to is as long as they keep coming, we're going to take care of them. Being a generalist and having a well-rounded practice is so much more attractive to me than the few extra dollars I would make.
A report by the Chicago Department of Health says it's increasingly difficult for uninsured and Medicaid patients to gain access to specialty care. The key reason? Relatively small physician payments. Well, that's this edition of Chicago Business Today. Again, you can read more about Dr. Ivankovich and Colias' story in this week's print edition of Crain's or on chicagobusiness.com. Thanks for watching. We'll see you tomorrow.